Are you a premenopausal or menopausal woman and you've noticed a lot of skin changes? Want to know what's going on? Want to know how to fix it? Hi, I'm Dr. Raghu Athre with Athre Facial Plastics in Houston, Texas. I am a double board certified facial plastic surgeon. So a huge portion of my practice is facial rejuvenation. So as you can imagine, if you do as much facial rejuvenation as I do, part of this whole process is also making sure that the skin looks as good as it can. And the age subset of the vast majority of my patients are in that pre, peri, postmenopausal range age group. So you become somewhat of a skin expert on all the things that pre and post-menopausal patients experience with respect to their skin. So let's go through this in this little chat, and some of these fixes are pretty simple. So why is that time in your life so different, and how does it change your texture and character of your skin? So estrogen is a really important hormone, okay? So estrogen is not just important for reproductive cycles and all that kind of stuff, but it actually controls a lot of the stuff on your skin, as well as they've been shown to have effects on energy level and all of those things. So if you want a complete list of all of those kinds of things, there's another talk on this on our channel, which is a podcast with Dr. Blackwell that talks about estrogen and hormone replacements, and there's a lot of information about all the definite results of estrogen on the human body. Now, for the purposes of this talk, estrogen is really important for maintaining skin texture. So if you've noticed a girl in her maybe 20s when she's got a lot of estrogen in her body, you're looking at plump skin that's super hydrated. It's got good bounce test. You push it, it bounces back right away, and there's a nice healthy thickness to the skin. Now, as that estrogen level starts falling, probably around the early, mid, late 40s, depending on genetic factors and all sorts of other factors, there's a change in the character of the skin. Some of these changes include the skin being more dry, the skin having less thickness, less bounce back. It doesn't look as supple, and it doesn't look like a nice memory foam pillow that has its bounce back. You push it, takes a while for it to come back up. So these are a lot of the changes that that patients complain about as they enter this stage of their life. Now, as we are doing a facelift or any major facial rejuvenation procedure, there's things that we do to the skin to enhance the appearance of the skin, because it's like icing on a cake for us. Now, so what are some of the things that can be done in order to address some of these changes? So I've made a list here of all these things, so I try not to forget any of these things as I'm giving this little chat with you guys. First thing, hydration. Hydration's really important. So as we've lost some of the integral proteins within the structure of the skin's ability to hold on to moisture is less. So now you add that to the fact that the oily layer, or the sebum layer that's on top of the skin, is also less. So therefore the skin kind of ends up looking a little leathery. You're seeing more noticeable fine lines and wrinkles. All of this is more apparent during the perimenopause and postmenopausal stages. Hydration is a huge component of this, and hydration can be broken down into multiple things. First of all, please make sure you're drinking enough water. This is the main and most important thing. Water is great, and also keep in mind that there are certain things that dehydrate you, mainly alcohol and caffeine, like coffee. So if you're drinking multiple cups of coffee, not only do you have to offset the losses that the caffeine is creating, you also need to maintain the hydration. So you may be drinking 2 cups of coffee thinking that, oh, I can add 2 cups of liquid that I've taken in today. Doesn't work that way, because the caffeine is actually dehydrating you. So you're going to have to kind of up the game and drink even more water. Water is by far the best source of hydration, and you need to be able to drink enough water on a daily basis. Now, there's other things that can be done also for moisturizing or increasing the hydration within the skin. First of all is a nice moisturizer. Moisturizers basically increase the amount of moisture within the skin layers, giving it a little bit more plumpness. There is basically a gradient of moisturizers, from simple moisturizers that you apply topically all the way to, for example, a hyaluronic acid serum, which has severe amount of moisture as it draws water within the tissues. And this is what gives hyaluronic acid serums its plumping effect by making the skin look more supple, thicker, and more firm, like a nice memory foam pillow. I think that's a great metaphor, and you kind of push it and it bounces back. Okay, diet is another main factor. So a lot of women in this age category have issues with weight gain. Okay, so their first immediate knee-jerk reaction is these drastic diets. Okay, drastic diets, first of all, have not been shown to really help in terms of long-term weight loss. But furthermore, all of these lack of these nutritional parameters are also being emphasized in the quality of your skin. So make sure you maintain a healthy diet. I do think that maintaining a healthy weight is also important, but this all comes in that idea of moderation in everything. So you want to make sure you're having equal parts of, proteins, carbohydrates, healthy fats, all of these types of various nutritional groups that we've been taught about, as opposed to these fad diets that go all on one and not on something else. So the other thing I think that is truly important is a good skincare regimen. Now, within the skincare regimen, I'm also going to give you kind of a gradient idea. The first and foremost, the most important thing, of course, is sunscreen. Now, sunscreen is important at any age, but as women progress into that peri and post-menopausal stage, one of the things that happens is the amount of production of sebum of the top oily layer is less. So once that oily layer is a little bit less, you're noticing a little bit more sun sensitivity, because that sebum is kind of acting like an insulation barrier protecting your skin. So sunscreen, very, very important, and it also prevents future damage to the skin, amplifying the effects of the loss of estrogen on the skin. Now, also in that skincare regimen can be things like retinoids. Retinoids are retinol, retin A. These are really very important in maintaining the maximum health of the skin. So what do retinoids do? So retinoids are vitamin A analogs, meaning they're in the family of vitamin A. And what they do is they increase cell turnover. So one of the things that I started off this talk is that estrogen, with the lack of estrogen, you're having a lot of breakdown of some of the integral proteins within the skin, which is collagen and elastin. Now, what the retinoids do is upregulate or turn the cells that are making collagen, elastin, and some of the structural proteins for the skin. They're turning them up. They're giving them some extra juice to say, let's crank this process up, thereby recreating a lot of these little integral proteins within the skin. So it's kind of increasing that turnover mechanism. And it makes sense, because any of you guys who have used retin A know that when you start using retin A, you flake off. Why are you flaking? Because you're upregulating that process. You're getting rid of old skin, making new skin. So this is something that is kind of a very important aspect of a good skincare regimen. Now, a little caveat here on the retinoids. There used to be a lot of information about using retinoids on almost a daily basis at night. We have since found out that there is no added value benefit of using it every day, and probably once to twice per week is more than sufficient in keeping that upregulation in your skin going in terms of creating collagen, elastin, and making those skin cells work at a faster rate. All right, So these are all some kind of minimalistic things that I think that you can do. Now let's talk to the next stage, upping the game a little bit. I think hormone replacement is definitely something that women should consider. Now, for the purposes of this talk specifically, hormone replacement does make your skin better. Okay, the quality of your skin looks better, the health of your skin looks better, the suppleness of your skin looks better. All of these various variables are definitely improved with hormone replacement. Now, I am a medical doctor. I am not a hormone replacement expert. There's a talk on here, as I mentioned earlier, on my YouTube channel, which is a podcast that I had with Dr. Blackwell. She's an excellent hormone replacement specialist. You have questions about hormone replacement, please either address it to her or talk to your gynecologist or talk to someone who is very well versed in hormone replacement. Hormone replacement is not a one-stop shop that can be just prescribed for everybody. There are things that need to be discussed, such as breast cancer risk, all these different types of risks, and we need to talk about family history, so you do need to have a medical provider, a physician, really evaluate the patient, symptom complex, all these different things, and figure out if hormone replacement is right for you. So it's not just something you call somebody up or go to a med spa clinic and say, hey, give me hormones. I don't think that that's a wise idea. I do think that more testing and more specific guided therapy is necessary if you're going to join into that group of hormone replacement. But for the purposes of this little quick chat, I do think that it's going to help your skin a great deal. Okay, so that is kind of upping the game. So we talked about some very minimalistic things like hydration, skincare, that kind of stuff. Then we talked about a systemic thing that we can do, which is hormone replacement. Then we can now up the game up to what kinds of treatments can we do on the skin itself to improve quality, texture, reduce fine lines, increase suppleness, all these things. So here's a couple of list of things that I've come up with. Some of the minimal things that you can do are some chemical peels. I think chemical peels are a great adjunct to improve the quality of the skin. There are different types of chemical peels, and chemical peels are basically broken down in terms of depth of peel. There are superficial peels that are kind of like the glycolic acids and the alpha hydroxy acids. Then you have the medium depth where you've got kind of dilute TCA peels. Then you've got deep depth, which are kind of high concentration TCA with or without phenol peels, deep phenol peels. So there's a whole category of peels. All of these peels are doing something very specific. They're basically taking off layers of skin. They're causing a controlled trauma to the skin, thereby upregulating that skin turnover activity and giving you fresh skin. So if you're interested in something like this, this would be a great opportunity. You can reach out to me, and we do all three of these depths of peels depending on what the patient needs. Again, it is not a one-size-fits-all solution. The patient's needs, the patient's skin care regimen, the patient's ethnic considerations, what their skin looks like in terms of what the apparent age of the skin is, all needs to be taken into account to find what is the best type of peel to be done on a patient to kind of reset the skin and turn back some of the effects of the estrogen loss. Microneedling. I love microneedling. I think microneedling is a great idea to kind of do some of this controlled trauma to the skin. It definitely increases that cell turnover. It can be used essentially in all skin types with very little risk or complication. So it is something that I think is in that next category of stuff that can be done. If you're interested in upkeep of your skin, definitely recommend microneedling. Caveat here, a big no-no to Morpheus. There's a separate video that I've included on here why I hate Morpheus, and I know that some people will kind of promote Morpheus, and one of the uses of it is in this category of patient who's looking for a quick pick-me-up. I do think that the Morpheus is actually setting you back. You may see a very short-term result. Long-term, you're hurting yourself by actually further removing or breaking down the subcutaneous fat right underneath the skin, actually making the skin thinner, more sallow, and less able to jump back and plump up again like the memory foam pillow. Then moving up to the next level above that would be lasers. There are two categories essentially of lasers that we can use, just like in the chemical peel where you kind of had the superficial, medium, and deep. In the laser section, I will kind of break that up into fractionated, which is really targeted at refreshing the skin and turning over the skin and making new collagen, and ablative, where you're taking layers of skin off and really forcing the skin to regrow new skin. This is kind of a simplification, but I think the rationale for me explaining it this way is that so in your head you can kind of see this as a spectrum of therapies ranging from minimal stuff to more complicated, more intense stuff. So in kind of conclusion, estrogen is really, really important in maintaining skin turgor, health, making you look young and youthful. Now, as women enter perimenopause, one of the things that they are going to notice is structural changes in their skin. And this is kind of a common time point where women come in and say, hey, I want to do something. Now, when we do facial rejuvenation, we always include the skin portion, what we're going to do, whether it's a treatment, whether it is skincare, all these different various things in order to maintain that skin health as supple, plump, hydrated. There's a range of treatments from general body nutrition type things that you can do to maintain your skin health. There are things that can be done kind of like microneedling, and also very intense therapies for much more aged skin, like deep chemical peels as well as ablative lasers. So I really hope that this little quick chat on skin health and effects of estrogen loss on skin health has been useful. You got a lot from it, and you find that maybe it prompts some more questions or things like that. First of all, if you love this content, you want more of this type of content, please hit us up and give us the subscribe and the like. It really lets me know things that you like, things that you want to hear more about. So making such content is actually really difficult and time consuming. So it kind of gives me some ideas on where I need to guide the content that I produce. Number two, if you have comments or questions, please, of course, put them down below in the comments section. I will do my best to get to you. If you have a more urgent question, please do not hesitate to look us up online, athrefacialplastics.com. The answer to your question may be there, or you can always put in an info request form through the website as well, and would be happy to get back to you. I really appreciate your time in watching this video. I'm Dr. Raghu Athre, Athre Facial Plastics, Houston, Texas. Thank you so much.